Have you been trying to get pregnant for more than a year now, but it's not happening? Relax. You are not alone. Many couples worldwide struggle with infertility silently, especially women in Nigeria. Hi, welcome to Health and Wellness with Dr. Happiness. I am Dr. Happiness, here to hold your hand through letting you know the causes of infertility and how to go about tackling them. In today's video, I will talk about mainly infertility in women. Next week, I will bring to you a video on causes of infertility in men. Remember, infertility is a couple's issue and not a woman issue. So now, let's dive in to the topic. Grab your seats and listen. Infertility is defined as the inability to conceive after 1 year of regular, unprotected intercourse. Remember the terms: regular, unprotected. It means you have to be having intercourse at least 3 times in a week. Unprotected. It is not once in a week, or once in 1 year, or once in 3 months. So what are the main causes of infertility in women? The causes of infertility in women can be traced through the reproductive system. The female reproductive system is made up of the ovaries, the fallopian tubes, the uterus. And at the level of the brain, you have the hypothalamus and the anterior pituitary. The hypothalamus and the anterior pituitary control what happens in the ovaries and the uterus, even the tubes. So, let's take it one after the other. At the level of the brain, the hypothalamus sends signal through the gonadotrophin-releasing hormone to the anterior pituitary, telling it to send signal to the ovaries. The anterior pituitary, listening, sends follicle-stimulating hormone to the ovaries to stimulate the follicles to mature and release the eggs, which is called ovulation. Along this line, hormones like estrogen, luteinizing hormone, and progesterone are released. One is the thyroid stimulating hormone that stimulates the thyroid. The thyroid gland is here, and it controls the body metabolism. The second one is prolactin, the hormone that is responsible for breast development and milk formation. It is usually high in women that are breastfeeding or pregnant. If you're not pregnant and your prolactin level is high, it can interfere with your fertility. If anything goes wrong along the hypothalamo-pituitary-ovarian axis, ovulation will be impacted. And so there are cases where some women have never had menses. It is called primary amenorrhea or hypothalamic amenorrhea, because there's problem at the level of the pituitary and the hypothalamus. Now, if you don't see menses, you cannot be pregnant because there will be no ovulation. At the level of the ovaries, there could be hormonal imbalance or polycystic ovary, PCOS, polycystic ovarian syndrome, where the ovaries release androgens that cause maturation of so many follicles and none is being released most of the time, impacting ovulation and impacting fertility. So if you have PCOS or irregular cycle, you could suffer from infertility. At the level of the fallopian tubes, their function is to serve as a pipeline through which the egg from the ovaries go to meet the sperms that come from the vagina. And it's at the level of the fallopian tubes that fertilization occurs. So the sperms go to meet the eggs inside the fallopian tubes. If for any reason the fallopian tubes are blocked due to repeated infections from pelvic inflammatory disease or a fibroid pressing on the tube, obstructing it, the egg cannot meet with the sperm. And so there will be no fertilization and no conception. At the level of the uterus, if there are fibroids blocking the inner lining of the uterus, Even when the eggs are fertilized and get to the uterus, they find it hard to implant because there's no way to implant. Or if the uterus, the inner lining of the uterus, the endometrium is scarred, scar tissues make the place sticky, and the fertilized egg cannot implant. Scar tissues arise from repeated infections like tuberculosis or repeated curettage, scraping of the uterus repeatedly, like during D&Cs, or even from uterine infections, endometritis. They will affect the implantation of the fertilized eggs, and there will be no conception. The next factor is your age. The older you are, the more difficult it is to achieve conception, because the older you are, the quantity and quality of the eggs start to reduce drastically from the age of more than 35 years. So there you have it. Those are the common causes of infertility in women. But remember the male factor, because it takes a man and a woman to make a baby. If the male has a problem with the sperm, you will not get pregnant, even if every other thing is normal. What do you do next? The most important thing is, if you know you are less than 35 years old and you're more than 1 year trying to conceive and you have not succeeded, it is time to see your doctor. If you are more than 35 years old and you have tried for 6 months, you've not conceived, go consult your doctor. The earlier you seek answers, the faster you get solutions to your problems. Book that appointment with your doctor. Answer every question your doctor asks you correctly. Don't hide anything. When the doctor gets your history, she will examine you and then order blood work. Blood will be collected for hormonal tests like follicle stimulating hormone, estradiol, anti-Mullerian hormone, thyroid stimulating hormone tests, serum prolactin. She will send you for ultrasound to look into your uterus. She will send you for hysterosalpingogram to check your tubes, whether they are open. And remember, lifestyle. Lifestyle factors also contribute to infertility. If you take so much alcohol, you have to stop or reduce to a glass a day. If you smoke, as a woman, stop. If you are obese, if your weight is too much, you have to start working out. Some women have achieved conception just by reducing their weight. And if you're too thin, it can also affect your fertility. So the two extremes of weight affect fertility. Take that action today, and tomorrow we'll be celebrating the arrival of your bundle of joy. If you've watched this video this far and you know you found value, please like the video, subscribe, and share to couples who you think might benefit from this video. And please, in the comment section, let us know if you have passed through infertility or know anyone that's going through infertility, what you have done to overcome yours. And if you have questions, please put them in the comment section. And together, let's build healthier and happier families. I am Dr. Happiness.